Hey guys, hope you're doing well. This is Dr. Arun Dhir, and I'm going to be touching upon a question that I get asked at least 3 to 4 times a week. And the question is, has my sleeve stretched? Now, let me take a few steps in order to firstly set a foundation and give you a bit of a background about what happens when we change the anatomy of an organ called stomach, because that's what we operate on when we're doing the gastric sleeve. But this is a question that bothers so many of my patients, and sadly it affects lots of women more than men. Now, I don't mean to be judging based on the individual preferences of each gender, but I think this question needs to be demystified. Now, what happens is whenever we operate on any organ in the body, and for the sake of argument, let's take the stomach because we're talking about the gastric sleeve. What happens is whenever we reduce a stomach that is size of a balloon almost into a long narrow tube, we create a lot of what is called as inflammatory edema. Edema means swelling in the area. So after a person has had a gastric sleeve, they feel that even taking sips of liquids is rather challenging. But slowly and surely, the swelling goes away, the edema settles down, and the lumen, which is basically the channel of passage which is there in the tube, slowly increases over a period of 6 to 8 weeks. So that's why we have the diet that transitions from liquid to pureed, then to semi-solids and things like that. So what we notice is that over the course of the following 3 to 6 months to up to 12 months, people are able to slowly increase the portion size of what they are actually eating. And that is called adaptation, because the stomach, which was so tight to begin with, has slowly, the inflammation has gone down and the body has adapted to it. So that is a normal process. It is not something that you need to get worried about. But I think sometimes when people have not been suitably educated about it, about the adaptation process, they start to get worried that initially I used to eat only from a small bowl, now I can eat from a quarter plate, and I can fit all of that in. Now, is there something wrong about it? So that is one part of it. Now, what that does is it also correlates with the rapidity or the speed with which your weight is being lost. Initially, weight loss is rapid because you're predominantly on a liquid diet, and then your stomach is also, the lumen is tight. But as the stomach is adapting, you are able to tolerate more food, which means your weight loss slows down. It gradually slows down. Now, whenever I've had an opportunity to go back in and do an endoscopy in individuals who may be experiencing some issues after a gastric sleeve surgery, 9 out of 10 times, I do not find that their stomach sleeve, the sleeve has actually stretched, despite the fact that they are reporting some weight regain. I often get people say 3-4 years after this gastric sleeve surgery saying that, hey doc, I'm pretty sure my sleeve has stretched. Can you please check it out? I have regained not all of my weight, but some portion of my weight. And 9 out of 10 times, as I said, I don't find that the sleeve is actually stretched. And then we kind of, confirm this by using a special scan, which is called a CT scan, which checks the volume. So it is a Fizz CT scan, which allows us to test the volume of the sleeve, whether it is actually stretched or not. So point that I'm trying to make is weight regain is not, or it has got little to do with the anatomy of the sleeve. What it has got more to do with is the gut-brain communication, which is the gut-brain axis, which involves nerve signals going from the gut to the brain and the other way around, and the hormones, the hunger hormones and all of that. So that's why we always say use your sleep as a tool to give yourself that nice push start. So once you lose your weight from here to here, maintenance becomes easier. Now, I'm going to give you 5 tips which is going to help you to connect better with your sleep, but also reduce your risk of stretching your sleep. And these are very crucial things. And I'll start with the first one, which is most important, is called eating mindfully. Now, eating mindfully has got 2 components to it. As the name suggests, you are mindful about what you're putting in your mouth. So the first component is that when you are having a meal outside or at home, wherever it is, try and connect with your food. Don't have a screen in front of you or a monitor in front of you, or checking your phone with one hand and putting food in your mouth. That's not mindful eating. What will happen is you will land up eating far more than what you need to, and slowly over a period of time, your portion size will increase to a point where you will start regaining the weight and your sleeve would have actually stretched. The second thing is, when you eat mindfully, you pay attention to feelings of fullness. Some people initially will notice it straight away because it's a stark change between normal stomach going to a baby stomach. So there's a huge shift after surgery immediately. But what happens is, over a period of time, with the adaptation coming in, what happens is that you have to focus a little bit harder to recognize that feeling of fullness. Okay, so that's where it is important that eating mindfully means you don't have to finish off everything on the plate. Take a small serve. If you're full, say thank you. Or if you feel the urge to go back for seconds, that's okay. At least you have recognized, because a lot of us have been brought up in this culture, finish everything on your plate. I'm sure our parents always said this and we all remember it. And when we are on the dining table, we want to make sure that we are not wasting even a single bit. So best is to take small amount to start with, and you can always go back for seconds. So that is about eating mindfully. The second thing is not to mix solids with liquids. What happens is that when you're mixing solids with liquids, you are actually causing the solid to wash down quickly and your stomach gets empty. So you feel the urge to go for more. So that's where we always say half an hour before and about 45 minutes after a meal is when you can actually take some liquids. And liquids can be in the form of water, tea, coffee, whatever works best for you. The third tip that I have, or the third advice that I have, is to take small, frequent meals. You've got a baby's tummy sitting in an adult's body. What that really means is that you've got to learn to eat like a baby. And that is actually a healthier way of eating. Small breakfast, have some nuts, or something for your morning tea, then have your lunch, afternoon tea. Again, it could be things like a little bit of salad, carrot sticks with hummus or celery sticks, something healthy that allows you to also reduce your hunger levels from going to a very high level. Then, because when they are at a very high level, you want to just go for food. Your system is really craving. So that's where it is important to have small, frequent meals like a baby. The fourth tip is, when you are socializing, it's very easy to forget that you've had a sleep. You feel like a normal person. You think you are a normal person like others. But please understand, if you start thinking of yourself as a normal person and go back to the old habits that you used to, which means go, party, drinks, and have food along with it, and don't pay attention to what your stomach is telling you, well, the food will actually slowly cause the stomach to stretch and you'll go back to your old habits. So especially when you're socializing, I always say, just have a quarter plate in your hand. That's like a reminder for you that, hey, I've had a sleep, I just need to be mindful of that, and I just need to be respectful of that. That's all there is. You don't have to get paranoid about it, that I can't eat this and I can't eat that. If you feel like having a little bit of piece of cake, it's your best friend's birthday, hey, go for it. There's nothing wrong with that. We are all human beings. We need to live life and enjoy it too. And the last and the most important thing is that maintain some sort of a follow-up with your weight loss team, your surgeon, your dietitian, psychologist, whoever may be a part of that team, because people who follow up maintain long-term success. This is all about a long-term success that we are interested in. We know that after weight loss surgery, you will lose weight by 10 to 12 months. But I'm interested in your long-term success. And that happens when you maintain that follow-up, where people pick up red flag signs that may be sort of, you may be averse to it, or you may not catch the attention of that because you've got so many other things to focus on in your life. But your team will be able to pick it up and say, hey, this is where you are kind of, deviating or digressing from the trajectory to your goal. Let's correct it and let's bring some measures into place and bring back. So because it's very easy to sway and go back to your old habits. And that's where the power of follow-up comes in. So I hope you found that video helpful. I think it is an ongoing journey of connecting with yourself. That's what I say, that when you understand what your body is telling you, you start to adapt yourself accordingly, and then you are in a state of health and wellness, and you have long-term success with your weight loss. Take care and have a blessed day.